How are you?
Good. It's been a couple of weeks. I apologize about last week.
No worries.
I wasn't feeling well.
Did you get your COVID shot and you had a COVID shot hangover?
That's that's exactly what it was. I had the AstraZeneca shot the day before, and I was fine. Then the day I've kind of felt weak and lightheaded, and anyways, and then the second day I was fine, 100%. Yeah. So
So there's a meme going around about younger folks like yourself and what the vaccine does. The three
okay.
state that I'll tell you what it is because
Yeah. Tell me
somebody I know who's very close to me is going through it right now. The three stages of COVID of the vaccine for young folks is excitement. I'm getting my
okay.
shot. OMG, what the heck just happened? I got hit by a Mack truck, and then okay, I'm fine now. That's it. Those are the three stages. And that's
Have,
because your immune system is better. That's
is it?
why. That's what the medical professionals have said. So there can be a reaction in younger folks because you're fighting it.
I'm
But
not
that's a
that.
good sign.
Marry me, word. I'm not that young, okay? So, like, so, did you see that
Just
video
go with
with?
it.
Okay, did you see the video with Jack Black?
I did not.
Okay,
Oh,
I'll
wait,
send.
maybe I did. Somebody sent me something that recently from him, so maybe it's the same one. But
Okay,
send
I'll
it to
send it
me.
over to you after the video, after a chat. Okay, let's get started. A lot of
Yeah.
questions. Let's start with vaccinations. How are
Okay.
the vaccinations going in Burlington?
Well, things are going very well. However, supply remains an issue, and that's not just for Burlington, that's across Canada, right? And so we have more people wanting to get vaccinated than we have supply. I'm on
Okay.
a wait list,
Are you?
right?
Okay.
I'm on a wait. I signed up to two pharmacies. I've yet to get a call to come and get my vaccine. So
Oh,
I know a lot of people are in that camp. I know people. I see it on my feeds even today. I'm signed up too, and because I'm encouraging people get the first shot you can and go out there and get vaccinated. And people are like, I'm trying. I'm on these wait lists. I've been waiting. I hear you. I feel your pain. I'm in that category myself. And we're just waiting for supply. So there's good news. We've heard about major new shipments coming that the federal government has secured very soon. So that should change the picture. Should change the picture quickly. The goal is to have the population vaccinated 65 to 70% of the population across the country, including Ontario, vaccinated by the end of May. That's a big
um,
number. Now in Halton, we're a little over 30% right now, and that's on target. So the goal in the province is to have 30% vaccinated by the end of April. We're almost at the end. Halton is already there. So we're right on par with where the plans and the supply has put us. But I do know that there's way more people that need to be vaccinated and want to get vaccinated, and we just don't have the vaccines.
true.
They're just not here yet.
Have you heard of Vaccine Hunters, the
Oh
Twitter account?
yeah, I
Yeah.
I signed up.
Oh,
I'm waiting for my postal code to pop
okay.
up. But in BC they have supply, I've heard.
Yeah, my brother and his whole family, not his whole family, but like his relatives and stuff, got word that a place in Mississauga had vaccines, so they all came down and they all got the shot same day.
Oh my
Anyway,
goodness.
yeah.
Wow. Yeah, I haven't seen anything pop up on in Burlington, and I'm
Okay.
assuming I'm assuming that for Vax Hunters you'd have to live in the community where I don't know, but like I
You don't?
assume I couldn't go to Mississauga or Toronto or somewhere to get it. That
No, you can.
oh,
There's no rules in pharmacies, I don't think. So
okay. Well,
yeah. Anyways, but sorry.
I'm up for a road trip. I don't have any
Yeah,
time between my Zoom calls to
yeah, sure.
go anywhere but my kitchen.
35 plus. When can they get vaccinated in the mass vaccination sites?
So it all depends on supply.
Okay.
Honestly, and I know that's a frustrating answer. It's frustrating for me to have to give it and not be able to give more clarity, but that is the
Yeah.
truth.
Okay.
Uh, the hope we're at 40 now, and we're at 50, we're at 60 at the clinics in Halton. So with this new shipment coming in May, countrywide, that should open up more age levels for May. It has to. So, you know, hopefully sometime in May we'll start to see those numbers the age numbers come down. But also, you know, at some point we just want to open the doors wide open. I have parents of 18, 19-year-olds that are grocery workers or working in retail. They're on the whatever essential retail is open. They're on the front lines of being at risk of being infected, and they're not eligible for anything right now. And I get that. I feel for that. And so, but we can't give a vaccine we don't have, right? That's the simple reality. So,
how is the COVID-19 situation in Burlington right now?
The numbers are starting to go down again slightly, and it kind of bounces up and down. I do the daily posts on my social of the numbers for Halton as well as for Burlington. Burlington has still got the lowest active case rate per capita in Halton region. We've done very well. So they're starting to slowly trend in the right direction, but we can't, you know, it's still too soon to start talking about reopening anything, right? Our hospital capacity GTA wide is still at risk. So, you know, people are doing really well, but, you know, we still have to be very, very cautious.
So I guess that's a good segue. After the 6-week stay-at-home order, where does Burlington end up?
Well, we're tied to the hospital capacity really Ontario-wide anymore. I mean, the situation had gotten so dire, as people know, with the third wave, that people were going hours from their home because there were no beds locally. And so it became an Ontario-wide issue. So even if the infection rates or active case rates in a particular area were not all that high, because hospital capacity across the province was at a critical state, you know, it has to stay closed until we get the hospital capacity issue down. So, you know, I watch those numbers carefully. The ICU occupancy of Joe Brandt is the lowest I've seen in about a week. It was in the 80s today or yesterday. It was over 100 at a point last week. So again, it fluctuates. And even if the capacity is low today, all it takes is one outbreak and you've got patients in your hospital. And the worst, you know, we're not going to start to see a change in the restrictions until A, hospital capacity comes down, and B, we can start going back to those surgeries that have had to be canceled, the so-called elective surgeries, which includes some things that I think a lot of people would say, that's elective? Wow, isn't that necessary essential surgery right now, like cancer treatment and things like that? So yeah, that's elective. So we're at huge risk if we don't get the infection rates down, the hospital capacity rates down, of a whole other health pandemic happening parallel to this one, because people can't get the preventative care that they need before their condition worsens. So we're still at a fairly critical phase here across Ontario and even in Burlington, because our hospital, obviously we're so close to the other hotspot areas, our hospital capacity fills up fairly quickly.
Park ambassador got verbally abused in a skate park. Am I reading that correctly? Can you tell us about? Yeah.
So yeah, I was made aware of it after the fact. I was emailed, and skate parks, folks may not know, are closed by provincial order. And a lot of people, that was confusing to a lot of people. When playgrounds reopened, people just assumed that meant all outdoor play type things like a skate park were reopened, and they weren't. So not only, so there were crowds of kids that have regularly gathered at the Norton skate park, which is up on Dundas near the high school there, that were there. So that in and of itself was an issue, because the skate parks are closed. People can't be gathering with anybody outside their own household, also by provincial order. And so we have park ambassadors, we have bylaw officers that regularly patrol, but in this case, the park ambassador was there. They're not a bylaw officer, they can't ticket. They have no enforcement authorities. Their role is to keep an eye out on our parks for things as simple as garbage cans are overflowing, But also, look, I'm seeing crowds gathering. It's a violation of our COVID. They would bring in bylaw officers if necessary. But our first approach is always just to let people know what the rules are, because, you know, after this incident happened, a number of people reached out and said, oh my gosh, I thought skate parks were open. And so understandable confusion about that. So their role was really to let the kids know you really can't be here. The skate park is closed. And the individual, based on the report that I got, the individual was surrounded, was sworn at, and was coughed on.
Wow.
As a gag, you know, but everyone knows what that means in an era of COVID.
Yeah.
So very disturbing incident. And so I put something out on my social feeds on Monday to call out the incident, to let folks know that skate parks were in fact closed, to let, you know, to say to people, like, nobody deserves that kind of treatment. Don't abuse our staff.
Yeah.
They're public servants, not punching bags. And there's really no disagreement about that. But what it prompted was first a firestorm of conversation around, you know, skate parks should be open, and legitimate concern for the mental health and well-being of students and young people who have had school taken away and need physical exercise. And those are all very legitimate issues. Absolutely. We can have a debate about should skate parks open. And in fact, the Halton mayors and chair last week put together a statement saying, look, we think the closure of outdoor amenities needs to be reviewed by the province and reconsidered, especially in light of the science table saying they should be reopened. We're with you on that, but that wasn't the point of the post. And until skate parks are reopened by the province, they are closed. And much as we may not like it, they are closed. But more to the point, nobody deserves to be abused and harassed, much less surrounded and sworn at, for simply letting people know what the rules are and to move along. So I'm hoping that we never ever see a repeat of that behavior in the city of Burlington. It's not how we roll. I know we're better than that. I know tempers are flaring. I know frustrations are high. And separately, I will absolutely go to bat, and already have, about a reconsideration of reopening outdoor amenities. There's no question we need to review that.
Well, let me ask about that. Well, first of all, did you talk to the park ambassador? Is he doing okay? Is he okay?
I have not personally, but I know that we have HR staff, we have workplace staff that have definitely been involved in talking and making sure the individual is okay, yes.
Okay, awesome. Let's talk about so have you heard from the province in regards to opening back up tennis courts, basketball courts, skate parks, or anything like that?
So yes and no, not directly. However,
it's never directly.
It's never directly. I know what you know. I read the papers, the headlines. But actually, no. The Premier called all heads of council in Ontario together for a meeting by phone Friday. So last Friday, a couple of days ago. Minister Elliott, Solicitor General Jones, Minister McNaughton, and Minister Clark. So they were all on the line. And one of the questions that came, that was my question. Was going to be, I was in the queue, I was pushing my I want to answer question button.
Well, welcome to our world.
Yeah, with 444 mayors on the call, they didn't get to me in an hour. So my question was going to be, are you going to reopen outdoor amenities? Are you going to reconsider the closure in light of the science table? And just for the record, the Halton mayors and chair have asked for this. So I didn't get to ask my question, but somebody did ask, one of the other mayors did ask specifically about golf courses. But the answer was more broad. So I'll tell you what the answer was, and it's not going to be one that it was disappointing to me, so I'm sure it's going to be disappointing to you. The answer was basically that golf courses and other outdoor amenities like a skate park, like all the other ones we're talking about, attract crowds and gatherings, and that's the chance for the virus to spread is in those crowds and gatherings. And so I got the sense that they were not in any hurry at any time soon to reopen them. And if I had to guess, they probably won't be reopened unless there's a lot more public pressure. from medical experts, from residents. We'll continue to pressure for a reconsideration, but it's probably not going to happen if things just go along the way they are until the whole lockdown is changed. And I think that is a lost opportunity. So we will continue to press the case. I encourage everybody who might be listening in or watching, please reach out to your MPP. Please be respectful. Please. They're human beings at the other end of that call. So you can make your case without making personal attacks. And it takes a little more effort sometimes to do that, but you'll actually get a better hearing if you do that. So please just let them know, for all the reasons that we've been talking about. If you need some help with your language, simply refer to the statement that the Halton mayors and chairs have put out and say, yeah, we want you to do that thing. And see where they need to hear from you. But they need to hear from all of you out there in a respectful manner, and they can take that to their cabinet colleagues. They can take that to the premier and start to do some work internally with the party and with the province to have a review of that. So I'm there. I'm on board. And in the meantime, the outdoor everything except playgrounds are closed. Now, parks for amenities, parks are open. You can go to a park with members of your own household, and you can go through the park. You can throw a ball with a member of your own household. That is still all okay. And I do strongly encourage people to get outside and get exercise. But you have to do so safely and do so with members of your own household right now. Those are the provincial regulations. Okay.
Regional Council recently voted in favor extending mandatory mask bylaw in Halton until December 31st. Yes. You mentioned that you'd be open to lifting this bylaw if circumstances prove that it's safe.
Yes.
All right.
What are those circumstances?
Yes.
There's no more COVID, or we've reached herd immunity, or we have enough people vaccinated that it's not a risk of spread, and it's not a risk to people's health.
Okay.
And that's the simplest. So, we did that in Burlington. I think it was December. It was late last year. We extended our bylaw for another full year, and we got some comments from people and a little bit of blowback. And why all the way to the end of December? And that's just depressing to think about. And why not do it every couple of months and review? And my response at the time, and it's the same when I voted at regional council to extend it to the end of December. We're going to be in this pandemic for a bit, but even as the vaccines come online, as we reach herd immunity, as we bring our infection rates down, we're going to still need other measures like masks as one of the tools to keep people safe. And I'd rather say, look, we're going to extend it till the end of the year. If we can lift it sooner, we will. Then every couple of months we're back saying, oh, we're still in this pandemic, let's extend it. I think our residents know the reality of the situation and the need for those other measures to continue to work together until we truly, and we don't want a fourth wave in the fall.
We're not getting a fourth wave.
We really do not. So we need to kick this third wave to the curb once and for all, get folks vaccinated, and then slowly start to see what a post-pandemic world looks like. That's going to take a bit of time, and I'm guessing we're going to need that mask bylaw till the end of the year.
Well, let's hope by October. Everybody will be vaccinated by the end of June. Everybody, first dose, and then 4 months after is October, right? Anyways, yeah. So we'll see.
Okay. It's always good to hope. I'm a silver lining person, as you know. We'll find, there's a lot of good coming. It's just tough times right now.
Yeah.
Just need to hang in there a little bit longer.
We'll get through it. Okay. I know you are very good at explaining to me procedures and how things work. And so paid sick days. I know that's a very, very hot topic. That's all we've been hearing about in the media.
Yep.
Can you explain to me how, and I understand that obviously we want, if somebody gets home, if somebody has COVID, they go home, and if they're living paycheck to paycheck, they'd get paid, and their pay period would not be interfered in any way. But how would this work logistically? And I've asked this to many people, and they maybe the system's not there yet, but do you know how it would work, sick pay?
So, yeah, so and the question, maybe the question you're asking is who would pay for it? Does the employer pay for it or does the government pay for it?
That
And
or more kind of like, let's just say I'm the guy that's sick,
yeah,
right?
so you're
What do
sick.
I have to do?
So you go home and you still collect a paycheck. It's as simple as that.
Okay.
Some organizations, and it depends on the company. There's no standardization, and that's the issue. So
Yeah.
at the city of Burlington, we get a certain number of paid sick days built right into our employment contract.
Okay.
So if you're sick and you take one of those sick days, you don't get your pay docked. You don't have to take a holiday vacation day. And, so there's a lot of workplaces that already have a set number of sick days, usually between about 10 and, 10 to 15, depends on the workplace.
Okay.
And I forget, to be honest, I forget what it is at the city of Burlington, but we do have already a policy of paid sick days. If you call in sick, you will not lose pay. And that should be the standard. So that's where it starts. Ideally, every organization has the same standard. The government has the power to legislate this and or, if necessary, pay for it, where employers would have difficulty paying for it. But what we are seeing is companies where there are no paid sick days. So you
Yeah.
are taking a pay cut if you say, I've got COVID, I have to stay home. Well, that's coming out of your paycheck, or you're not going to get any vacation time this year. We'll use up your 2 weeks of vacation and then we'll see where we're at. Or I don't know if I have COVID, but I've been ordered under quarantine by public health because I've been, my COVID alert went off, or somebody in my family tested positive, or whatever. It may not even be you that's sick, but you can't go to work. And that's 2 weeks. That's a 14-day quarantine.
Yeah.
That's 10, roughly 10 work days,
Yeah.
right? And 2 weekends. So, there are people who could absorb one sick day in their pay. They shouldn't have to, but to take a pay cut, that's half your salary for a month. Could
Sure.
any one of us out there absorb a cut to half our salary? Anybody? I couldn't. I got bills.
Yeah.
Could anybody do that? So what we're saying is, and for some, like at the city of Burlington, there's a sick leave provision already. But for those, so the government has the power to either legislate a standard number of sick days that employers have to provide.
Okay.
And they could also say, and we'll help you out a little. We'll pay for X number of them, all of them, some of them, one of them, whatever. And so the province is kind of talking about, maybe paying for a couple of days, but it really needs to be legislated. So it's a requirement. And then you figure out, is it a shared cost between the employer and the province? Does the province pick up the tab? And I know people are saying that comes out of my taxes. And it's like, yeah, well, you know what? If that person infects their whole family and they end up in the ICU, you're paying for their care out of your taxes. And it's a whole lot more,
True.
a whole lot more than paying for sick leave to prevent them from getting sick in the first place. So preventive medicine is worth every penny we can throw at it. Sick leave is preventive medicine. And we don't want to have to make people choose between going to work sick, putting food on the table, and potentially risking the health of their whole family. So, and the other issue is this one. So, in Mississauga, Peel, and some other regions have said, if there are 5 people sick in a workplace, we're shutting the whole workplace down. Guess what? You've just shut that business down for 2 weeks.
Yeah. 10 days.
Both the healthy people in the business and now everybody.
True.
And the business, the essential service comes grinding to a halt. Wouldn't it be better for the economy, for the business, for all the employees that work there, if you simply take the 5 folks before they get sick, let them stay home and recover, keep the business running with the healthy folks and not have to shut anything down? That's what paid sick leave will do.
True.
then we don't have to stop the economy. So there is the economic argument is actually in favor of sick leave.
Okay.
That is the clearest way I can put it.
And to be honest, thanks for clearing that up. I did ask a lot of people, and that's the most clearest answer I've gotten. So, thanks, so I appreciate it. And it's like, so
I've kept my reputation as the explainer in chief.
Yeah.
Good. Awesome.
So I'm guessing that this sick pay is really for smaller workplace outbreaks that can afford sick pay. It's not for the Amazons. It's not for the Canada Post. It's not for, because those guys get sick pay already.
Well, if they do, I don't know. Like, I don't know what the larger corp. Okay, so if a company has paid sick leave, then they've already looked after their employees, and we just need more employees to take advantage of that sick leave and not come in when they're sick. Okay. For any workplaces that don't have sick leave, it needs to be mandated as a standard policy, and then the government needs to figure out whether to, how much to supplement that, so it's not 100% on the backs of the businesses. We do that already with EI. We do that with pension. Like, we already have cost shared programs with employees, with businesses, so that they don't bear 100% of the cost of programs that we all agree are the right ones. So this is another one of those. It should be a cost shared program.
All right, 27 minutes in. Sorry, I'm going to ask a few more. Okay. The simple one. Any tickets handed out over the last week or two in regards to bylaw officers or anything?
So I don't know about the last week or two, but we just did get an overall update from our police. 764 tickets written since the beginning of the pandemic.
764. Okay. Oh, okay.
Lot. So I don't know how many of those were issued in the last 2 weeks, but so I don't have that breakdown by month. But yeah, they will issue, and they do issue tickets. And we're exploring, do we need to yank the licenses of businesses that are repeat offenders? So that's the next level of dialogue. If we have to go there, if we continue, because we're not going to keep sending bylaw officers out and continue to write tickets. When we can just, what, you've been warned, you know what the rules are.
Are they repeat offenders? Are a lot of them repeat offenders?
Yes.
Yeah. Okay. And Oakville hired a bunch of new bylaw officers. Yes. Is Burlington going to do the same?
We did hire some new ones. I don't know actually how many Oakville hired, but yes, we did get 2 new ones like a month and a half ago. But we recognized that even pre-pandemic, we needed to add resources. And in my time on council, last term and this term, we have consistently added more and more bylaw resources, and COVID has just shown. And as I said, we did just add a couple of more 2 months ago, but we're still, the demand for service, especially in COVID, because all the other bylaw enforcement issues are still there. Property standards and sign violations and noise and all the other bylaw calls that we get are still there. And in fact, we're getting more of them. We've seen a 200% increase overall in calls. 200, because everyone's home.
True.
Everyone's home, and so people notice the noise more, and they're whatever. It is what it is. So we simply, we simply can't. We're not able to keep up. But we are adding more resources, and we're going to do the best that we can, and focus on the areas of greatest health and safety risk is what our bylaw officers are doing now. So there's a bit of a triage.
Nice. Okay. And anything else you want to bring up? Any comments or anything?
Well, let me see. What have I done today?
It's probably the most casual interview you have all week.
It is. Yeah. No, it's good. It is good. I guess what I want to say to the community is, I'm really proud of our residents. They've done really, really well under exceptionally different circumstances. Our residents, our businesses have hung in there. We've lost some, and it's heartbreaking. But so many, we've got new ones opening. And so as we've said throughout this pandemic, it's affected all of us, but it's affected all of us in different ways. It's really hurt some people a whole lot more than others. And so Burlington has shown that we're compassionate, that we care for each other. Council has put resources on the table for residents, for businesses. Our community has really, really done well, and I'm really proud. And what we talked about earlier, the situation with the staff, that's rare. Thankfully, it shouldn't have happened. It's not going to happen again. I know it won't. But by and large, people have done really well. So I just want to affirm that. I want to just encourage people to hang in, take care of yourself, take care of each other. These are tough times. None of us ever expected to be in a third wave that was worse than the beginning of this pandemic. None of us. But we're strong and we can get through it. And I do see hope and light at the end of the tunnel, actually sooner than I thought we would get there. So that gives me hope every day. And my final appeal would just be kind to each other. Don't judge. You don't know what someone's situation is. Be kind. Especially be kind to your public servants. We're there to help you. We're not your punching bag. So take time to send somebody a nice note. If you want to thank our roads and parks or our recreation services or anybody at the city, send it to me. I'll make sure they get it. They could really use a kind word right now. and it would just make me happy to read like good things in my inbox.
Sure.
But yeah, reach out to our police, our fire, our paramedics, all of our people at the hospital. Send a nice note. Spread some love and some kindness. We all need a little bit of that right now.
Awesome. Just letting you know too that I don't know if I told you, but our interviews, our chats have surpassed over 1 million views combined over the last I guess how many weeks we've been doing it. Like I'm getting a year update now, and I see it like us. I'm like, so, but yeah, our videos have surpassed over just you and I. So yeah,
that's awesome. Well worth the effort, and thanks for initiating these. I'm always glad to be able to talk directly to the community. A lot of people watch it because I get the feedback after. So keep
okay.
That. I do, yes.
Okay.
Yes, I do.
Yeah.
I hear from folks all the time.
Okay. I'll send you the Jack Black.
Please do.
Yeah, it's funny. Just it's Jack Black. So
I love Jack Black.
Yeah. So I'll send it over to you. All right. Thanks so much.
Okay.
All right.
Have a great rest of your day. Take care.
Take care.
Bye-bye.